Module 6, Prescription Medication Misuse and Illicit Drugs. Now remember to continue to take notes as we work through Module 6. To recap, in Module 1, we covered the physical and mental impacts of addiction. In Module 2, we explored some of the financial and legal implications, and remember that costs can vary state by state. In Module 3, we covered how substance use and misuse can impact your family and relationships. And we also had a brief introduction into ways you can build a healthy relationship with youth. In Module 4, we explored how substance use impacts your career and your employers. And finally, in the previous module, Module 5, we focused specifically on marijuana and alcohol. In this final module, we'll focus on prescription medication misuse and other illicit drugs. The Centers for Disease Control and Prevention, or CDC, classifies prescription drug abuse as the fastest growing drug issue and epidemic in the nation. According to the CDC, as of 2009 in the United States, more people die each year from drug overdoses than car accidents. Misuse of prescription drugs means taking a medication in a manner or dose other than prescribed. It could also mean taking someone else's prescription, even if it's for a legitimate medical complaint such as pain. And it also means taking a medication to feel euphoria or to feel better and get high. The term non-medical use of prescription drugs also refers to these categories of misuse. The three classes of medication most commonly misused are opioids, which are usually prescribed to treat pain, central nervous system depressants, and this category includes tranquilizers, sedatives, and hypnotics, and those are used to treat anxiety and sleep disorders. And finally, stimulants, which are most often prescribed to treat attention deficit hyperactivity disorder, or ADHD. Prescription drug misuse can have serious medical consequences. Increases in prescription drug misuse over the last 15 years are reflected in increased emergency room visits, overdose deaths associated with prescription drugs and treatment admissions for prescription drug use disorders, and the most severe form of which is addiction. Among those who reported past year non-medical use of prescription drug, nearly 12% met the criteria for a prescription drug use disorder. Unintentional overdose deaths involving opioid pain relievers have more than quadrupled since 1999 and have outnumbered those involving heroin and cocaine since 2002. Both prescription and over-the-counter drugs should be taken cautiously and only in accordance with directions. Dosage may depend on factors that only doctors are trained to assess, such as personal health factors, potential for abuse and addiction, and your family history. Consuming prescription drugs in ways other than prescribed by your doctor puts you at risk for addiction and abuse. Opioids, such as Vicodin and Oxycontin, are the most commonly abused prescription drugs in adults. Being prescribed a painkiller increases the likelihood of abuse. Even those with legitimate prescriptions can easily become addicted if they're not taking their medications as directed. Individuals and teens report abusing stimulants, such as Adderall, to help them focus and stay awake. Painkillers can be extremely addictive if taken for too long. The body can build up a tolerance to painkillers. This makes it extremely important to talk with your doctor about your dosage and how you manage your pain. Never take more of your medication than was prescribed to you. Should you feel that your prescription needs to be changed, immediately call your doctor. Individuals have reported getting prescription drugs from friends and family members. Sharing prescription medications with others is illegal and dangerous. Prescription drugs react differently when taken by those who were not prescribed the drug and could lead to an accidental overdose and many other health risks. More and more people are making the decision to abuse prescription drugs each day. While the amount of DUIs and alcohol-related car accidents have decreased in the past 5 years, prescription drug abuse has increased. So let's review. Opioid painkillers are the most frequently abused prescription drugs. Prescription drug abuse is a rapidly growing issue that has turned into the largest drug epidemic in the nation. Several thousand people begin abusing prescription drugs each day, and friends and family members are a common source of prescription drugs for abuse. To avoid abusing prescription drugs, be sure to never share your medications, dispose of them properly, and only take as prescribed by your doctor. So let's talk now about commonly used illegal drugs. Commonly used illegal drugs include marijuana, heroin, cocaine, amphetamines and methamphetamines, as well as club drugs. The following slides provide examples of their commercial and street names, how they are administered, their effects, the health risks, and other information associated with those drugs. Now here's a chart on opioids. Take a moment to look at it. It lists the name of the drug, some common commercial or street names, and how it's used. It also includes below the chart what someone may feel after using this drug. Now here we're talking about opioids as an illicit substance such as heroin and opium. This is not to be confused with opioids, how we talked about them earlier, as a prescription medication such as Vicodin or Oxycontin. Now here's some additional information. Every day, more than 115 people in the United States die after overdosing on an opioid. The misuse of and addiction to opioids, which does include prescription pain relievers, but also heroin and synthetic opioids such as fentanyl, is a serious national crisis that affects public health as well as social and economic welfare. The Centers for Disease Control and Prevention estimates that the total economic burden of prescription opioid misuse alone in the United States is $78.5 billion a year. And that includes the cost of health care, lost productivity, addiction treatment, and also criminal justice involvement. Now here's a chart on stimulants. Just like the previous chart, it lists the drug name, its common commercial or street names, and how it's used. And then below the chart, it lists the effects someone may feel after using that drug. Now here's some additional information to know. Scientists at the U.S. Department of Health and Human Services have completed the first comprehensive analysis of the prevalence of prescription stimulant use, misuse, use disorders, and motivations for misuse among the U.S. adult population. Looking at annual averages, approximately 6.6% or 16 million of U.S. adults used prescription stimulants in the preceding year. 4.5% or 11 million used prescription stimulants appropriately. 2.1% or 5 million misused prescription stimulants at least once. And 0.2% or 400,000 had prescription stimulant use disorders. The authors of this research found that prescription stimulant use without misuse, misuse without use disorders, and use disorders were all higher among adults with major depressive episodes and suicidal ideation, as well as substance use problems. More than half, or 56.3%, cited cognitive enhancement, which means thinking more clearly, being more awake, as the reason for misusing prescription stimulants. Although purportedly used to increase alertness and concentration, research has shown that cognitive improvement from prescription stimulants is minimal and often inconsistent. The scientists point out that action should be taken to expand safe, evidence-based treatment for attention deficit hyperactivity disorder and to decrease prescribing that may leave unused stimulants available for potential misuse. Clinicians can also screen for and identify adults with an increased risk for prescription stimulant misuse and pay attention to their motivations for that misuse. Now here's a chart on club drugs. Again, it lists the name, its common commercial or street names, and how it's used. Club drugs are a group of psychoactive drugs. They act on the central nervous system and can cause changes in mood, awareness, and how you act. These drugs are often abused by young adults at all-night dance parties and dance clubs and bars. Now here's a list related to club drugs that talks about the acute effects and health risks associated to using those types of drugs. Take a few moments to read through the list. What's important to know about all of this is that all drug use comes with risks. Now here are some ways to know if it's time to seek help. There's no blood, urine, or tissue tests that alone diagnose the disease of addiction. It is diagnosed by a person's behavioral symptoms, which include continued compulsive use of tobacco, alcohol, or other drugs, or other compulsive behaviors in spite of damaging health and social consequences. Is it time for an assessment? Sadly, many people suffer in silence, but know that help is available. Some people may not know where to turn to, but again, help is available. Sometimes, knowing the signs and symptoms of when it is time to seek help can be a great start. Talk to a healthcare provider if you've experienced 2 or more of these symptoms in the last year. Often taking more of the substance for a longer period than intended. Ongoing desire or unsuccessful efforts to reduce use. A great deal of time spent to obtain, use, or recover from a substance. Craving that substance. Failing to fulfill obligations at work, home, or school as a result of continued use. Continued use despite ongoing social or relationship problems caused or worsened by that use. Giving up or reducing social, occupational, and recreational activities because of use. Repeated use in physically dangerous situations like drinking or using other drugs while driving, or smoking in bed. Continued use despite ongoing physical or mental health problems caused or worsened by use. Developing a tolerance, feeling less effect from the substance with continued use. And experiencing withdrawal symptoms after reducing use. And symptoms vary by substance. Withdrawal does not happen with all substances. Examples include inhalants and hallucinogens. Here's a list of resources that are available to you should you think that you or someone you know may need help. Well, this concludes our 6-part series. What we ask for you to do now is to make sure you go visit your HR representative to receive your assessment and directions for completing it.